Okay, Sherry, thank you very, very much. I'm very, very pleased to be here and to return after many years to Washington State. I'm going to spend my allocated time this evening talking about why is this so hard to get done in the United States? You know, that's a question that I've been thinking about for some time. Most other wealthy countries have healthcare systems that cover everybody, so healthcare as a human right is a reality in almost every other wealthy country in the world. Their systems are much more popular with their publics, with their doctors, with their patients, and with their politicians than ours is. They have better outcomes according to international studies. The latest one released a couple weeks ago by the Commonwealth Fund. And by the way, they cost on average about half of what ours cost. So what's so hard to understand about that? You know, and what's going on here is my question. And so I'd like to talk a bit about what I call the underlying pathology of our healthcare system. Now, for those of you who are not physicians, let me explain for just a minute what underlying pathology means. Everybody knows what a sign or a symptom is. For example, if you have a skin rash, it could be caused by a number of things. Most skin rashes will respond to a steroid topical cream, at least temporarily. And they may be caused by a variety of things. They may be due to an allergy to the dye in your clothing, or it may be due to a drug you're taking, or it could be leukemia. Leukemia presents sometimes as a skin rash. So in order to treat not just the signs and symptoms, but the underlying disease, you have to understand what it is and diagnose what it is, because the treatments are very, very different. So I think that we have to look at the underlying pathology in our healthcare system, not just the signs and symptoms. The signs and symptoms are things like a large number of uninsured people. Medical bankruptcy is the leading cause of personal bankruptcy in our country, spotty quality, out of control costs, and so on. These are all symptoms. And in my view, the underlying pathology is something far deeper and more culturally important to Americans. For example, we're the only country in the world that treats healthcare as a business. And I saw that developing just as I was leaving Washington in the late 70s, where it became okay to think about healthcare as a business. What people didn't seem to understand is that the mission of a healthcare system and the mission of a business are very different. Okay, what's the mission of a business, any business? What do all businesses? Well, it's to create wealth for its owners. That's what they do. That's what they're all about. Do we really want a healthcare system whose primary mission is to create wealth for its owners? So that's one source of underlying pathology. And let me just know, so we shouldn't think of healthcare or accept the notion of healthcare as a business. It's something different. We also have to stopping talking about insurance and insurance reform as a way of financing healthcare. It's not that the insurance system needs to be better regulated, it's that it has to be eliminated because the fundamental business of insurance is slicing and dicing people into risk pools and then pricing policies to cover the risk. That's what they do. The biggest department in any insurance company is the underwriting department, and that's what these guys do all day. They're not doing anything wrong. They're doing what they know how to do and what they're expected to do, and if they're for-profit companies, their focus is on the bottom line. And that's something that has to be understood. This is not a failure of the insurance business. This is a failure of public policy because we let them do it. So demonizing the insurance companies doesn't get you anywhere. They're just doing what they have to do, and we have to figure out a way to sort of ease them out of the picture entirely and replace them with a tax-based system. Finally, we have this love of marketplaces and competition. We want more competition. I read that every day. We need more competition in healthcare. Well, as a matter of fact, competition in healthcare doesn't work. We have a system that relies more upon competition and marketplaces than any other system in the world. And what do we have as a result? Out of control prices, large numbers of uninsured people, medical bankruptcies, spotty quality, that we have done that experiment and it has failed. So let's just recognize that and move on to something that actually works. And the reason marketplaces don't work in healthcare were explained very well by an economist at Berkeley named George Akerlof. And Professor Akerlof wrote a paper that won the Nobel Prize in economics, pointing out that in markets where there's a large asymmetry in information between the sellers and the buyers, in other words, the sellers know a lot more than the buyers do about what they're selling, those markets inevitably, quality deteriorates in them and they inevitably become corrupt. And unfortunately, I think that's exactly what's happened to our healthcare system. It's become corrupted by the fact that the sellers have, that is the doctors and hospitals and drug companies and so on, have more information than patients do and always will. And even if the information were more equal, patients are often under stress, are scared, frightened, sick. They're not in a position to make a dispassionate purchasing decision as you would if you were buying a television set or a car or a computer. So this whole business about getting the consumers more skin in the game is total nonsense. And we have been sold a bill of goods by the corporate interests that are profiteering so handsomely from our dysfunctional healthcare system. So I think that we have to begin to look at these underlying pathologies and keep them in mind as we develop messaging to try to change the public dialogue. The framing of the nature of this problem has to be changed. This is not a problem of insurance reform and perfecting health insurance. It's replacing health insurance that is able to guarantee healthcare as a human right. That's what we need to do. So what are the barriers to reform? I mean, I've laid this out, and what are the barriers to reform? I'm a great fan of mnemonics, being a physician. It allows you to remember things you otherwise would prefer to forget. And so I've devised a mnemonic for the barriers to reform. And I think of a fig. We bought some wonderful big giant figs in our recent visit to Vancouver just before we came here. And a fig stands for the 4 major barriers to reform among the American public. Apathy, I've got mine, not my problem, right? I have good health insurance, why should I worry about anybody else? Or I'm healthy and I don't encounter the healthcare system, so I don't have to think about it. Fear of change, fear that you'll lose what you have. There's a lot of insecurity out there. And fear of loss of income, fear by corporations of losing this golden goose that they're milking so effectively. So fear is a big issue. Ignorance, people don't know how the healthcare system works. They don't know that in other wealthy countries, people don't even think about money when they get sick because they prepaid. It's all done beforehand. There's a sense of political solidarity that comes from everybody belonging to the same system, so everybody has a stake in making it work. In contrast, here we have dozens of different systems pitting one group against another. The young people against old people, sick people against well people, poor people against rich people, so on and so forth. So it's very important to begin to overcome that and understand that we're all in it together, and that's the way to do it. They also don't understand that it's actually cheaper, less expensive, fewer dollars that is, to insure everybody than it is to spend a lot of money, time, and effort trying to figure out who not to insure. I recently did a column in the Bangor Daily News about what it's costing every resident of the state of Maine to keep some people from having health insurance. How much are you willing to pay to make sure somebody else has to grovel for their health care? And it worked out last year to be $1,500 a year per person, $6,000 for a family of 4, in a state where the average income is $35,000. And this column arose from a discussion I had with a plumber last winter. And I tried to explain to him how everybody would be better off if we simply expanded Medicare to cover everyone. And he said, well, you mean single payer? And I said, that's right, I do. And he said, I'm against that. And I said, why is that? He said, don't you understand that we're paying to take care of people anyway, whether they have insurance or not, but we're doing it the most expensive way? And don't you understand that it's actually cheaper? He could not be moved off of his position. And the reason was because I was talking facts to him, and he was reacting to his own fear and anger and insecurity. He said, I'm working my butt off, freezing my butt off, trying to find your frozen pipe, and I'm paying for my own insurance, and I don't want to pay for insurance for somebody who's sitting at home on their couch. I just don't want to do it. So I did this little calculation and said, well, okay, when are you going to want to do it? When it's $2,000 a year per person, $2,500, $3,000? What's it going to take? But I think I made the point, and at least made him think about it. I didn't change his mind because he was reacting emotionally. So that is something we have to understand. That we simply have to understand that there's a lot of ignorance there, not only about how healthcare works in this country, but when you tell people that folks in other countries don't worry about money when they get sick, they can't get their mind around that, because that's all they worry about here. Healthcare is the leading cause of personal bankruptcy in this country. So, and then the G on FIG is good old-fashioned greed. There's a lot of money, $3 trillion a year almost in this system. Corporate profit, people are making money hand over fist. Corporate profits are high. There are lots of people who are performing administrative tasks or tasks as navigators or lawyers or consultants to help people figure out the complexity of the Affordable Care Act. Now, I'm not anti-Affordable Care Act. I think it was a remarkable political accomplishment given the nature of what's going on in Washington these days. And I give the people, Nancy Pelosi and Michelle Obama, Barack Obama, whoever pushed this through against resistance from this inner staff in the Congress and in the White House to get this done. But having said that, it's a pretty messy piece of public policy. It's not good public policy. It is unfair in the way its benefits are distributed. It is unfair in the way it's financed. And later on the panel we can go into exactly how it's unfair, but it's patently unfair in the way all its goodies are distributed and the way it's paid for. And that has to be pointed out to people. And I think that we at Maine AllCare are trying to do that by doing grassroots organizing at a local level, which you can do in a state with 1.3 million people a lot more easily than you can in a larger state, but nevertheless, that's what we're doing. So I think it's very important to change the framing of this discussion and to begin to think of some of the things I've suggested as ways to change the way people think about the nature of the problem. Where do we go from here? Well, I think the action is going to move to the states beginning in 2017. When a provision within the Affordable Care Act kicks in that says the states essentially can do their own thing as long as it doesn't cost any more and provides at least as many benefits as the ACA does. That was a provision that was authored by Senator Ron Wyden. And that's something that I think you're going to see a lot of states wanting to do their own things, very different things to be sure. But we'd like to see more states follow the example of Vermont, which has already passed a law taking advantage of this provision, saying we want to get to a publicly managed universal health care system in Vermont by the year 2017. And they've now set up a commission to figure out how do we get from here to there. Now, this is not easy. If this were easy, it would have been done a long time ago. But I think the next inflection point in this debate is going to be 2017 when the state innovations waiver provision of the Affordable Care Act kicks in. And states will have to apply to the government to get it done. They'll have to get permission from the Department of Health and Human Services to do it. But I think that's more likely. I'm not looking, and I'm sure Congressman McDermott has some thoughts about this, I'm not looking for a lot of dramatic action from Washington. There's just too much gridlock. The country is too heterogeneous to do it on a national level all at once. So I think we ought to look to the states to get this done. So, and forming coalitions at the local level and doing a lot of hard grassroots work is the way to do it. So we'll have a chance to talk more at the panel discussion. So